right here on Startup Central is Sohit Kapoor, the co-founder of DRiefcase. Sohit, welcome to Startup Central. You have been working with the government. I believe you work with iSpirt to come out with the initial framework as well. So as we enter a year of the announcement of the National Digital Health Mission, how has the last 365 days been for you folks?
Thanks for having me, Nantara. And yes, NDHM is fairly is a very big thing. The last 1 year has been quite intense for all of us. Early on, iSpirt was driving the whole framework for creation of the NDHM framework. We were providing our inputs to them, and then the Honorable Prime Minister announced it on 15th of August. Post that, NDHM was launched in a pilot phase across the 6 union territories. And there has been a sandbox environment where a few solutions have been testing the whole framework as we speak. So we've been what is called a personal health locker in that framework amongst the first ones. And what a personal health locker means is a platform which helps patients or users manage their medical records digitally. So it would be the one place where you can all have all your medical records stored in a secured environment with minimal effort. So yes, an involved process and a very satisfying one. We hope to see the NDHM go live soon, and then the broader public would be able to see the advantages of NDHM.
So Sohit, I would imagine because of coronavirus, the pandemic, the glaring need to have an integrated healthcare platform, you're not alone in this space. Many startups like yours perhaps will need to go live. You're also bootstrapped. What's the plan from here on, and what will be your differentiator?
So you're absolutely right. There will be, given the size of the country, we need multiple platforms to work in tandem to deliver, the advantages of NDHM to the broader public. We will be one of them. The differentiator we have is, the biggest challenge that a personal health locker faces is that of a user journey. How do you make it very smooth, very seamless? As a concept, when I tell you, Nantara, would you like to have all your medical records, at one place digitally, in a digitally secured environment, which you can find in less than 10 seconds? And you'd be like, absolutely. So that's the way to go. But if I left it to you to, kind of bring all your records onto this platform, it just doesn't work. We all have time, we all have our time commitments and priorities, and somehow this doesn't fall into that. So our whole differentiator is to make this whole journey seamless for the user, very, very smooth. So which means, without putting in any effort, if I told you all your records will come onto this platform, that's where it works. And simple things, we can send a team home to scan and upload your records. We provide you an email ID. So, it could be something like a combination of your first name and last name @DRiefcase.com, and you mail anything to it, or your lab emails anything to it. It goes in your DRiefcase health locker. So that's the whole idea. And with NDHM, this is the whole process. We are trying to automate it so that you set it up once, and then going forward, your records, wherever they are created, whichever lab, whichever hospital they are created, as long as that lab or the hospital is also into the NDHM framework, these records should flow into your locker in an automated manner instantaneously. So that's the whole one piece of getting your records onto this platform seamlessly, which is the differentiator. And the second big challenge for a user or a patient is when you have to find that record. You'll realize that when you're looking for a medical record, it's usually a situation of stress. And you want to be able to find that record in an instant, in less than few seconds. That's where the second differentiator lies. That we index each and every record that comes onto the platform for very simple things which you'll remember a document by. What's the name of the doctor? What's the name of hospital? What's the type of document? Or what's the date? So using a combination of these elements, these parameters, a user can find a record on DRiefcase platform in seconds, in less than 10 seconds.
Okay, so and I understand that yours is also the only service that lets you scan the records also at home. It's going to be very difficult to digitize everybody's records overnight and all of that. But Sohit, before I let you go, like I said at the start, it's going to be almost a year since this was announced. Are you in the beta phase? Are you about to go live? Is this going to be a paid for service? How's it going to work?
Sure. So DRiefcase as a health locker has been live for a few years now, but this is minus the NDHM piece of it. NDHM is expected to go live fairly soon. And once that happens, we will kind of add that integration onto our platform. DRiefcase is a free service as far as the locker piece is concerned. The home scan and the courier pickup are charged service, but otherwise it's a free service for people. The app is available on App Store and Play Store. So, people can just go download the app, register themselves. And as I said, keep uploading their records either through the DRiefcase ID that is given to them. They can click a picture and upload. If they reach out to us, we have services to collect the documents from home or come to their home to scan, which are charged very reasonably. So that's the existing live portion. As I said, once NDHM goes live, this whole setting up of the automated locker where records are tagged to your health ID. You'd remember the Prime Minister said every citizen can create a health ID, which would become the centerpiece of this framework. So in my case, let's say Sohit at NDHM is the health ID. Now, if any of my providers is linked to this platform, they will tag my records to Sohit at NDHM. And once the record is created, it will be pulled into the locker. That's the piece that is being tested right now and will go live once NDHM goes live.
Okay, so let's see if we get an announcement, follow-up announcement on the NDHM on 15th of August. That's going to mark 1 year. But till then, Sohit, thank you so much for taking the time out, for joining us here live on Startup Central. We really appreciate you taking the time out.
Thank you so much.